mentioned, I'm Dr. Niamh O'Hara. I'm the CEO and one of the co-founders of Biotia. I'm also a research assistant professor at SUNY Downstate, and I'm going to be talking about early warning for pandemic preparedness. So there's a clear need for an early warning system. The COVID-19 pandemic, of course, underscored this, revealed the global health, social systems, and economies are incredibly fragile and increasingly interconnected. It also demonstrated the value of community-based data sharing. So this has been, I'm going to actually talk a bit about this in a couple minutes. Despite this, we're actually witnessing a dismantling of a lot of these infectious disease monitoring programs. More than half of all infectious diseases could be made worse by climate change, and this is also compounded by land use changes, as shown in the video here. This is especially evident for vector or mosquito-borne pathogens as their habitats and breeding grounds expand. We are experiencing rising rates of drug resistance in many of these pathogens causing these infections. But despite this complexity, the factors that lead to pandemics are largely actually predictable. So I'm going to talk a little bit about genomics and how genomics is useful here. So all living things, including pathogens, as you know, contain genetic material, DNA and RNA. We use genomics, or the study of that genetic material, to not only identify pathogens, but also characterize and understand them. So what strains of influenza are circulating in a population, if a pathogen is evolving. So this video here shows genomics at work for SARS-CoV-2. On the left-hand side, you can see mutations accumulating, giving rise to different variants. And then on the right-hand side, you can see those variants distributed across the world. So in this way, we can really actually see how a virus evolves, and this can be used to inform public health response. So for example, when to go into lockdown or restrict travel. These data are also used to design diagnostic assays and vaccines as well. But ultimately, I wanted to include this video here because it really shows the triumph of science during the pandemic and what can happen when researchers share their data globally. And so what we want to see is this sort of sharing for all pathogens. So there are a few ongoing infectious disease monitoring programs. There are a number across the world, so I'm going to highlight a couple here. The first is the World Health Organization, their hub for genomic excellence in infectious disease. And so they have a network of 150 countries. They've been using genomics and epidemiology to track infectious disease. Another program is the Sentinel program. And so this was started by the African Center of Excellence for Genomics and Infectious Disease and the Broad Institute. They're operating in West Africa, and they're building lightweight assays that can be deployed in the field, and then also some deeply insightful genomics-based assays. At Biotia, we have recently launched the Pathogen Watchtower program. So this is, together with support from the Rockefeller Foundation, we were able to support work across 12 organizations across the world. So this is in 8 countries and 4 continents. I'm going to highlight a couple of these groups here. So we have a group in Chile who are doing viral surveillance of avian migratory hotspots. So they are collecting bird droppings, and they are sequencing them and identifying viruses that are circulating. This is especially relevant given the recent avian influenza outbreak and the fact that increasingly we're actually seeing migratory birds carrying avian influenza. Another group in Nigeria is collecting blood samples from a rural community, from patients in a rural community, and looking at co-infection of arboviruses and malaria. And then our partners in Brazil, who are affiliated with Fiocruz, are doing biosurveillance of circulating viruses using mosquito metagenomics. So they've actually set up thousands of traps, teeny mosquito traps across the country, and they grind up these mosquitoes, do sequencing, and identify viruses that are circulating in these populations. So I'm outlining here some of the components we've identified of an early warning system. for an early warning system, you need to put it in context, right? So there are drivers that are increasing these infectious disease threats that we're seeing. They include climate change, other environmental disruptions, biodiversity loss, globalization, social determinants of health are all key factors. We onboard varied data streams onto the early warning system that we've developed. It's important to not only look at epidemiological data, so we onboard genomics data and Earth observation data, climate data, human mobility, socioeconomic data, and media. And we structure the data in using a federated approach. So in this way, the owner retains the data, the user retains ownership, and the insights are shared. So this preserves data sovereignty, and it really is especially important as we're working across borders, so for international collaboration. We have been building this out in a community-driven way, so we actually have a very sort of open platform where distributed teams develop data science for their specific use cases. And then in terms of output, we produce risk maps that a lot of work needs to go into integration with public health systems and agencies to inform response. So for example, vector control, where and when to spray for mosquitoes, coordination of resources, and then the data is also used in diagnostic design and vaccine design. The impact is data-driven decisions, improve public health outcomes. As I mentioned, we have been working at Biotia, building an early warning system, which we call GeoSeek. And we've just done an alpha launch of this platform in November. And we already have more than 100 countries' data on there and more than 40,000 genomic samples. And we've built this together with the Rockefeller Foundation and Fiocruz and Institut Pasteur. And we were honored to present to the United Nations General Assembly about a month ago, together with the WHO. So we're really working to build international support and collaboration around this. So some key takeaways. We are adopting a philosophy of global data philanthropy and a new logistics for locally sourced information. Genomics provides a key insight here, but it's important to incorporate varied data streams. So climate data, Earth observation data, epidemiology, social determinants of health. And then an effective early warning system really needs to be integrated with local public health teams to guide interventions. We have a preprint that is up that's also under peer review, so if you're interested more on that. And we have a home for GeoSeek at geoseek.com. And again, this is really an open platform, so we're looking for collaborators and building this out together. So feel free to contact us or come find me. And just wanted to thank Dr. Kraft and Ricky and the NextMed Health team, our team at Biotia, our partners at the Rockefeller Foundation, my co-founder, Dr. Chris Mason at Weill Cornell, and the Metasub Consortium. And thanks so much for your time.
Thank you, Niamh.